All right. Well, thank you, everybody. I want to introduce to you Jennifer Combs, our field nurse case manager with the Ohio Department of Health in the Children with Medical Handicaps program. She's going to talk to us tonight in a little more detail about the program and specifically how that can benefit our children and adults who have Down syndrome. So thank you, Jennifer.
Hi. Good evening. I'm Jennifer Combs. Like Maggie said, I am a nurse with the Children with Medical Handicaps program through the Ohio Department of Health. I am going to be talking to you this evening about the program. So what is the Children with Medical Handicaps program? We are a tax-supported healthcare program within the Ohio Department of Health. We are a safety net program for children who have eligible chronic medical conditions. We're a program that helps families obtain payment for needed medical services. We're a program that links families to a network of over 11,000 specialized healthcare providers. So as part of being enrolled in the Children with Medical Handicaps program, you have to see a Children with Medical Handicaps approved provider. And I explain that as a traditional health insurance. When you have health insurance, you have to see an in-network provider. It's the same concept. You have to see a Children with Medical Handicaps approved provider. It is also a program that collaborates with public health nurses and local health departments to increase access to care. The mission of our program is through the development and support of high-quality coordinated systems that children with special health care needs and their families obtain comprehensive care and services that are family-centered, community-based, and culturally competent. Our program is written in the Ohio Revised Code. So it is law. And so when we are processing an application into the program, we do have to follow the law. So it is the Ohio Administrative Code is chapter 3701-43. And you can read that if you would like. We also have other quality assurance measures in place. We have a medical advisory council, and it's mandated in the Ohio Revised Code. And this is physicians from all over the state of Ohio, from all different disciplines, and they help advise on medical diagnoses and treatments. We also have a parent advisory council, and this consists of parents or grandparents who have had children on the program, and they help advise our program on how to better serve families. And we have two parent consultants. One is Kim Matthews, and the other is Melissa James. And I did give some handouts regarding the parent consultants. They can provide support in regards to the Children with Medical Handicaps program. They have actually had a child or a spouse on the program. So they can share their lived experiences and provide feedback, and help you get connected to additional supports within the community. So like other state agencies or nonprofits or other local partners. So the Parent Advisory Council helps advise our program how to better serve families. We also have a pharmacy advisory council, and they help advise on medications for children on the program. So our program is funded in several ways. We receive federal monies through the Maternal Child Health Block Grant. So all states receive this monies. How they use the monies differ from state to state. So part of our funding through the Maternal Child Health Block Grant supports the Children with Medical Handicaps program. We also have a line item in the state budget for our program. Most of our funding comes through county set-aside taxes. If you own property in the state of Ohio, 1/10 of a mil of your property tax comes out to support this program. So we would never discourage anyone from applying. If you own property in the state of Ohio, you are supporting this program. We do receive some funding through third-party reimbursements and donation funds. However, our main three funding sources are federal, state, and county set-aside taxes. Within the Children with Medical Handicaps program, there are several programs that fall within our program. We have a diagnostic program, a treatment program, a hospital-based team service coordination program, adult cystic fibrosis program, adult hemophilia insurance premium payment program, and a metabolic formula program. We serve over 40,000 clients annually. So 40,000 clients in the state of Ohio annually we serve. Today, I'm going to talk about the diagnostic and treatment program because those are the two programs that will affect you. The diagnostic program is authorized for a 6 to 9 month time period to rule out a handicapping condition, to diagnose a handicapping condition, or to establish a plan of treatment. To be eligible for the diagnostic program, you have to be birth up to the age of 21, be an Ohio resident. You do not have to be a US citizen, but you have to be an Ohio resident under the care of a Children with Medical Handicaps approved physician or an advanced practice nurse. And you have to have a suspected special health care need. A child with Down syndrome would be eligible for the diagnostic program with the Down syndrome diagnosis. With the diagnostic program, there is no financial eligibility. So you would not have to send in any financial information to be eligible for the diagnostic program. So what's covered under diagnostic services? On your approval letter, it would say basic outpatient services, which means your child could go and have lab tests, x-rays, any special tests to rule out or diagnose a condition. It would cover physical therapy, occupational therapy, or speech therapy evaluations. It also says basic physician services. Basic physician service means you can see any Children with Medical Handicaps approved provider to rule out or diagnose a condition. So your child would be eligible for diagnostic services with the Down syndrome diagnosis, but then you can go to multiple specialty areas to rule out and or diagnose other conditions, such as a heart diagnosis, thyroid, vision, maybe if you're having some breathing problems, So you could go to all these other specialty areas to rule out or diagnose these conditions. All of our letters of approval have public health nurse services. If you're on our program, diagnostic or treatment, public health nurse services are authorized. There are public health nurses and local health departments that can help you navigate this program and provide information about other community agencies that could assist you and your child. It also includes community nutritional consults. So we have community nutritionists that would come into your home and do a nutritional assessment on your child. And the fifth thing on a diagnostic letter of approval is what's called enhanced care management. And this is the time that a physician or advanced practice nurse might spend on your child over and above the time they spend with your child in the clinic setting. So if they're collaborating with other physicians, they could receive payment for that extra time spent doing that. Major services can be added. So up to 5 inpatient hospital days could be added. Biopsies and anesthesia, psychological or neuropsychological evaluations, emergency room visits, emergency room transport, and a dental consult. These things can be added to a diagnostic letter of approval. So for instance, if your child is born and they are taken to a children with medical handicaps NICU, so Good Sam Hospital has children with medical handicaps NICU, UC, or if they're transferred to Cincinnati Children's NICU, 5 inpatient days could be added, and we would help cover that 5 inpatient hospital days. Ineligible conditions. So we do not cover acute conditions. So if your child would fall and break their arm, or they would have the flu and you would go to the emergency department, we don't cover acute conditions. We don't cover common refractory errors, like nearsighted, farsighted. However, we do cover eye muscle control issues, glaucoma, some other eye diagnoses. We don't cover emotional, behavioral, or mental health problems. However, we would issue a diagnostic letter of approval to rule out autism. However, autism would not be covered under the treatment program. We do not cover experimental care, developmental delay, learning disabilities, physical exams, or routine well child care. So I'm just going to recap. The diagnostic program is to rule out or diagnose or establish a plan of treatment. It's authorized for 6 to 9 months. Right now, it's being authorized for a 9-month time period to rule out or diagnose a condition, and there's no financial eligibility. The treatment program is then to provide ongoing services for a child that's medically eligible and financially eligible. Approval for treatment services is authorized for 1 year and can be renewed up to the age of 22. So this was a recent change in the law that began on July 1st of this year. So anybody who qualifies, so medically and financially qualifies, if starting July 1st of 2021, the age eligibility for treatment services is now 22. Next year, the age increase will be to 23. So currently, the treatment program is authorized up to age 22. The diagnostic program is staying the same. It's from birth to 21. Treatment program is now birth to age 22. So who's eligible for treatment services? So birth up to the age of 22. We do have a separate program for adults with cystic fibrosis and a hemophilia insurance premium payment program. You have to be an Ohio resident. You do not have to be a US citizen. You would have to be under the care of a Children with Medical Handicaps approved physician or advanced practice nurse, have an eligible medical handicap, and must be financially eligible. Examples of conditions. So this is not all inclusive by any means. We cover hundreds of diagnoses. These are just some of the major birth defects or medical conditions that we cover. So cleft lip and palate, hemophilia, sickle cell disease, AIDS, scoliosis, epilepsy, cancer, chronic pulmonary disease, birth defects, cerebral palsy, spina bifida, congenital heart defects, hearing loss, cystic fibrosis, diabetes, and severe vision disorders. Again, this is not a complete list. We cover hundreds of diagnoses. So ineligible conditions, again, we don't cover acute or infectious conditions, common refractory errors, emotional or behavioral problems, psychological or emotional disorders, learning disabilities, experimental care, routine orthodontia problems, well child care or physical exams, routine well child care, and developmental delay. These are ineligible conditions. So services that are covered on a treatment program, it's going to be based on the child's diagnosis. So these are some services that could be covered on a treatment service package. Inpatient hospital days, medical surgical supplies and equipment, special formula, surgery and anesthesia, prescription medications, therapies, orthodontist services for children that have a cranial facial abnormality, orthotics and prosthetics, and dental care. Dental care is on every treatment letter of approval. We feel like oral health is important to the overall well-being of the child. So as long as you're going to a Children with Medical Handicaps dental provider, your child could have cleanings, x-rays, sealants, fillings, things like that, routine dental care. So with the treatment program, there is financial guidelines. So you have to be eligible financially. Financial eligibility is based on a case-by-case basis. If you submit your financial information and it is determined that you would be Medicaid eligible, we would ask you to apply to Medicaid. We are a safety net program, and we seek other payers prior to us. So if you would be eligible for Medicaid and your child's not on Medicaid, we would send you a letter saying you would need to apply to Medicaid. If you are already receiving benefits through Medicaid, you are eligible for our program. So if you're not active on the Medicaid program, you will receive a financial packet in the mail. Financial eligibility is based on 185% of the federal poverty level. We are different from Medicaid in that we do not count the income of a step parent. We do look at the family size, and then we make deductions. So we make deductions on how much you pay out of pocket for health insurance, how much you pay out of pocket for childcare expenses, and then you get a service level credit based on your child's diagnosis. Typically, this is $1,000 that would be deducted from your gross income. It could be up to $2,000 if you have 2 children on the program. People always ask me or tell me, oh, I'm not going to be financially eligible, so I'm not even going to try. And my advice to you would be to send in your financial information and let the Children with Medical Handicaps program determine if you are financially eligible or not. I'm not somebody that could just look at your financial gross income and say, nope, you're not going to be eligible, or yes, you are going to be eligible, because all these things are deducted and then determination is made. So send in your financial information and let the Children with Medical Handicaps make the determination. Then if you are determined to be over income, you will receive a denial letter in the mail saying that you're over income for treatment services. So if it's determined that you're not financially eligible, you're going to get a letter in the mail. And then you will receive information about the Children with Medical Handicaps cost share program. And I explain this more as like a deductible. So when you have a deductible, you have to pay so much money out of pocket before your medical expenses will start being covered. It's the same thing. So based on your financial information that you submit will determine if you get a cost share or not. If you do get a cost share, you have to show us that you've paid so much money out of pocket before we will start covering medical expenses. So you'll receive a letter stating you're over income and be given a denial date. You'll be given a cost share dollar amount, and then you'll receive an information sheet on how to meet your cost share. So application into the Children with Medical Handicaps program. To be enrolled in the program, you would need to sign an application form. And this is the medical application form. And you would complete 1 through 25, which is just information about your child and your family and your insurance information. And then on the back, you do have to sign. This is giving authorization to be enrolled into the program. So on the second page, you have to sign that you are giving consent, you want to enroll your child in the program. Once you complete your portion, the physician's office would complete the rest, and they would send it to the Children with Medical Handicaps program with a medical report. So for you, you would have to complete the first part, the demographic information and your insurance information, and you would have to sign the application. So the general guidelines for the application process for treatment program, you have to have a qualifying medical condition. You have to see a Children with Medical Handicaps approved provider. The physician would submit the medical application form on behalf of your child. And you must sign the medical application form giving consent for financial eligibility. If you're not Medicaid active, you would get a financial packet in the mail. Once you send in your financial information, if it is determined that you would be Medicaid active, you would apply to Medicaid. And you must complete the financial application and supply financial documents. And that would include 3 pay stubs for each parent that works and your most recent federal income tax 1040 form with an attachment. All that information is sent to you in the mail, so you don't have to remember it. The financial packet would come and be specific on exactly what financial information you would need to submit. Once approved for services, a letter of approval would be generated. And I'm going to show you a letter of approval. So it's a piece of paper that would come to you in the mail. All letters of approval look the same. So I'm going to show you where you want to look for diagnostic and treatment program, to see what program your child is enrolled on. So you can see here with the approval letter, it has your child's name. It would be their case number. So that would be their Children with Medical Handicaps identifying number, their birth date, your address, the legal guardian, and telephone numbers. It would have insurance information. It tells you which health department you're related to. So if you have questions, you'll say, okay, for this instance, Hamilton County General Health District is my health department that I would need to contact for questions or to help me with this program. It has who your managing physician is. And then it tells you what diagnoses you're on the program for. And down here at the bottom, you'll see diagnostic program. So like I said, the letters of approval all look the same, but you'll want to look down here at the bottom to see what program this letter of approval is for. And then it has the date range. So right now, diagnostic letters of approval are being authorized for a 9-month time period. So that would be, the effective dates are based on the dates on the application. So this one's eligible for 9 months. Then if you turn your letter of approval over, if you turn it over, it tells what services are being authorized. So it has five services, and then this one has an emergency room visit added and an inpatient hospital stay added. So that's a diagnostic letter of approval. And then the treatment letter of approval looks the same, has the same information at the top of the letter, your demographic information, your insurance information, what health department you're associated with, who the managing physician is, and what diagnoses you're on the treatment program for. Now, the treatment program is a little different than the diagnostic. So with the diagnostic program, you need one diagnosis on there. You can go to multiple children with medical handicaps approved provider to rule out or diagnose that condition. With the treatment program, in order for us to cover a service, it has to be related to the diagnoses on the letter of approval. So for you, you could possibly have a child that has a cardiac diagnosis, maybe a vision diagnosis, or even a thyroid diagnosis. So you could have 3 diagnoses on the letter of approval, and we would help cover medical expenses related to all 3 of those diagnoses. If only the cardiac diagnosis is on there, that's what we would cover services related to. So you would want to be sure that all your child's diagnoses that are eligible are on your letter of approval. And treatment services is authorized for 1 year, and it can be renewed every year up to the age of 22 with continued medical and financial determination. For treatment reapplication medically, you must be seen once a year by your managing physician or a provider within that department. On the back of the treatment letter of approval is the service package. So this child had a craniofacial abnormality, cleft lip and palate. And so the service package is related to that diagnosis. So you can see it has an orthodontic consult. Here it says orthodontic services. So a child with a craniofacial abnormality would be eligible for orthodontia. So that's on the letter of approval. So it's specific to the diagnoses on the letter. So that is a diagnostic and a treatment letter of approval. So why would you want to have the Children with Medical Handicaps program? So as I told you before, everything is written in the Ohio Revised Code. So when a hospital or a physician or a pharmacy comes on as a provider, they are agreeing to follow the law. And so if your child's on the program, you don't have to pay co-pays or deductibles. And you say, well, how does that work? Well, if you have insurance and you have a deductible, Cincinnati Children's would bill your insurance company and you would be denied because you have not, or they wouldn't pay the claim because you haven't met your deductible. So that goes back to Cincinnati Children's and says you haven't met your deductible, that you would be eligible for that charge. Well, Cincinnati Children's then sees, okay, well, they have CMH, and they'll send the claim to our program, and we would pay that claim, and that amount then you could use towards your deductible. So if your child's on the program, you don't pay co-pays or deductibles. Providers may not charge families for any portion of the cost of services that are authorized by our program. So the provider's not permitted to balance bill. So what does that mean? So say your claim is $1,000 and your insurance company paid $500. And so we come back and say, well, our allowable amount is $400. Insurance has already paid more than our allowable amount. And so Children's cannot bill you for the remainder of the portion of the claim. So they can't bill you for the remainder $500. When providers sign on, they sign up to take our payment as payment in full. We are always the payer of last resort. So insurance would pay, Medicaid, and then our program. There is a lot of valuable information on the Ohio Department of Health website. I just wanted to show that to you and how you would navigate to our section of the web page. So here is the Ohio Department of Health website. Up here is the A to Z index. So you would click on A to Z, click on C for Children with Medical Handicaps program. And I can come down here and click Children with Medical Handicaps, and it takes you to our section of the web page. And you can see here, there is a section here for family resources. If I scroll down here to the bottom of the page, it has brochures. And one of the information sheets that I gave you was a newsletter. They're here, and then forms that are commonly used. So the financial form, the medical application form, if you have any change. So this is common forms that are used. But there's a lot of valuable information on the website. So you can go there and you can look at the website. How do you know if you are seeing a Children with Medical Handicaps approved provider? I would always recommend that you contact your local public health nurse. If you have somebody in mind, you have a name, they can look it up and see if that person is a provider or not. People at Cincinnati Children's have access to our provider portal, where they could also look it up and see if that physician is a provider or not. So when you're going to other departments, you want to be sure you're seeing a Children with Medical Handicaps approved provider if you're expecting us to pay for that cost. And I put this slide in here. Do other states have programs like the Children with Medical Handicaps program? Yes, they do. All states receive funding. So you're living in the Cincinnati region now, but maybe you're going to move to Florida and you want to know what program is eligible in Florida. There's a link that you can go to. It brings up the United States, and you would click on Florida and it would bring up contact information for you to call to see what is available in Florida. And then the last slide is my contact information. Typically, you would reach out to your public health nurse as your primary contact. If for some reason you can't get a hold of your public health nurse, I would be more than happy to assist you. But your public health nurse should be your primary contact.